Welcome to Shared Decision Making for Aging Veterans. This is Shared Decision Making Facilitation Training, the third component of a three-part orientation and training series for the implementation of shared decision making for aging veterans at a clinic, in a service line, or into a new or existing program. This facilitation training follows a leadership orientation and shared decision making team training 1. The leadership orientation is designed for the medical center leadership, such as the center director, nursing executive, and social work director. Team Training 1, which you should have already completed, is designed for an entire care team or service line that will be implementing shared decision making. There are 2 videos embedded in this training. Watch the videos in their entirety in order to go to the next training section. To activate the videos, click on the arrow icon. There are many valuable references and additional resources for much of the information provided in this training. They can be accessed by clicking on the magnifying glass icon in the lower right corner of many of the slides. At the end of the training, there is a quality improvement assessment and an opportunity to provide feedback. Thank you for taking time to do this, as it will help us improve future trainings. We will start with an overview of and implementation guidelines for shared decision making for aging veterans. Then we will move on to strategies about how to involve veterans, family caregivers, and the entire care team in the shared decision making process. We will cover communication barriers as well as common strategies to overcome them. Next, you'll view a model scenario video and then practice shared decision-making facilitation skills with brief case studies. Last, we'll review the key components of successful implementation and next steps for implementing shared decision-making for aging veterans. Let's get started with a review of shared decision-making and the implementation guidelines. Shared decision-making is a collaborative, patient-directed decision-making process for preference-sensitive choices. The shared decision-making process can assist veterans in clarifying their goals based on discussions of what matters most to them. It can help them assess their needs, including their health-related needs, establish priorities, and make choices that align with their goals and priorities. The focus is on what matters most to the veterans. Input from the healthcare team ensures the veteran understands the likely course of their illness or conditions and how those affect their needs and priorities. This information may affect the choices they make. Shared decision-making involves the entire care team, and it supports many VA initiatives. It also acknowledges variation in process. Shared decision-making is an evidence-based approach. There is a large and growing evidence base for shared decision-making as indicated by this table. Overall, shared decision-making, including the use of decision aids, is linked with better outcomes for patients and families, including improved knowledge, feeling better informed, and increased involvement in decisions and care. Click on the icon at the bottom of this page to see the research references on shared decision-making. We focus on older veterans because almost half of the veterans served by VHA are over 65. Indeed, about 70% of all people over 65 will need long-term services and support someday. Those over 80 are the fastest growing cohort, and these veterans are the most likely to have multiple chronic conditions and to need long-term services and supports. One goal of the shared decision-making process is to shift the locus of decision-making from a medical model focusing on provider expertise toward a process of patient-directed decisions. As we move across the spectrum from the more traditional medical model toward patient-directed care, we move through a place of patient-centered care. This is care that focuses on the needs of the patient, such as a Saturday clinic for those who work 8 to 5 on weekdays. Patient-centered care is important, but it does not address how decisions are made. Patient engagement begins when to address involving patients in the decision-making process. We engage them in discussions. However, this may still fall short of having them be the central decision-maker. When we implement patient-directed care, we go further by saying that not only is the patient involved, but the patient is in charge, and that ultimately, the decisions are theirs. Guidelines for implementing shared decision-making for aging veterans include: encourage the use of the Geriatrics and Extended Care website, www.va.gov/geriatrics, as well as the hard copy materials contained in the shared decision-making folder. Connect veterans with a social worker or the primary person facilitating the shared decision-making process. Encourage the veteran to involve a family caregiver if there is one and if appropriate. And explain the full range of long-term services and supports. And the implementation guidelines also include use of the decision aid worksheets to discuss the veteran's goals, needs, and preferences. To prompt the veteran to talk with their medical care provider to obtain information about the likely course of their conditions and to get their questions answered. To foster collaborative discussions about long-term services and supports options with involvement of the veteran, family caregiver, social worker, and care team. And to facilitate care and long-term services and supports decisions that support the veteran's choices. Let's review strategies for involving veterans, family caregivers, and the entire care team in shared decision-making discussions. Shared decision-making for aging veterans can be used for making choices, any choices, but particularly those preference-sensitive decisions about topics that frequently address the needs of our aging population. Applying the shared decision-making process takes a team effort with the veteran at the center, in many cases surrounded by one or more family caregivers and with involvement of the entire care team, including a physician, nurses, a host of other care team members, and a social worker. You can encourage the veteran's involvement as key decision maker. Keep in mind that some veterans will say they do not want to be involved, but we know from research that most want to be involved even when they say they don't. Encourage involvement in the shared decision-making process by helping veterans to identify their goals, needs, and priorities. Engaging them in discussions or prompting them to ask their providers about their health status and its effect on their functional status, now and in the future, as this information may affect choices about the long-term services and supports that may best support their goals and priorities. By reviewing information about long-term services and supports and completing the Veterans Shared Decision-Making Worksheet, and urging veterans to discuss their choices with their care team and their family caregiver. The family caregiver or caregivers may or may not live with the veteran, and the relationship may be more or less positive. In most cases, caregiver involvement should be encouraged. Caregivers may play a role in supporting the veteran as the key decision maker. The Caregiver Self-Assessment Worksheet is helpful in the process of assessing needs and capacity for providing support. It is possible that caregiver input may affect the veteran's choices about advanced care planning or long-term services and supports, such as which services are needed, or even options for where the veteran lives while receiving services. Caregivers also have a role in talking with the veteran and communicating their capacity for providing support, including limits related to caregiving. And caregivers may participate in discussions about the veteran's advanced care plan, as they often have a key role in its implementation. It is also critical to involve all appropriate care team members within VA and outside of VA. That's one of the reasons part of the orientation and training for shared decision-making includes Team Training 1 for entire care teams. In addition, it's helpful to designate a primary contact person for the veteran and family caregiver, to clarify roles of various team members for a given patient, and to present consistent information about healthcare status and prognosis. Now let's look at some of the communication and implementation barriers you may encounter and strategies to overcome them. There are many challenges associated with talking about topics related to aging. They are often difficult topics. Communication barriers with older adults may be caused by aging-related health problems, such as hearing or vision deficits, dementia, or side effects from medications, such as fatigue. Low health literacy, over 60% of people over 65 in our country are at a basic or below basic level of health literacy. Communication barriers may also be caused by denial about declines in functional ability or just not wanting to talk about the aging process because they are uncertain or afraid. There may be a dislike, a serious dislike, for talking about getting worse or dying, or changes they may have to make related to requiring assistance for activities of daily living or to accommodate declines in function. And there may be environmental issues like background noise or lack of a private space for a conversation. Strategies for overcoming and effectively dealing with these communication issues are a focus of shared decision-making facilitation training too. Shared decision-making discussions can be sensitive, so they rely on trust among the participants. It takes practice to become skilled in having conversations about goals and preferences. In addition to good communication skills such as active listening and starting where the veteran is at, prepare yourself by making sure the environment is set up well, quiet, and free of distractions. Be patient and allow enough time to accommodate the various aspects of aging that may impact optimal communication, as well as to elicit veterans' values, goals, and preferences. And when talking with veterans and family caregivers, ask them if they are ready to talk about sensitive topics such as long-term services and supports or advanced care planning. Discussions about long-term services and supports or advanced care plans are difficult for many people and may be in part due to denial, fear, and avoidance related to discussing the aging process, chronic diseases, or getting worse, loss of independence, and death. Reluctance to participate in discussions among those who are more comfortable with the doctor making decisions for them, it may be hard, or reluctance to participate in discussions among those who are more comfortable with the doctor making decisions for them. It may be hard to strike a balance between respecting autonomy and stimulating involvement in shared decision-making. Open-ended questions may be a more effective way to elicit what matters most to the veteran, such as, "Tell me about your priorities," or try a universal, non-threatening approach by sharing a story or anecdote and saying, "Many veterans your age are," and then fill in the blank, completing an advance directive, and starting to think about their plans for aging right where they live now. There can be many challenges posed by family dynamics, such as past resentments, poor communication skills, or disagreements about the best course of action. With communication among spouses or other family members, note that often assumptions are made that those close to us know us well, including what we think, feel, and mean. It is not uncommon for folks to feel surprised or annoyed when those close to us misunderstand what we're talking about. And talking with people we know well is actually more difficult than talking with those we hardly know at all. One strategy is to try an opener that acknowledges these dynamics, such as, "It's hard to talk about these topics and can be even harder when it's about us or involves our loved one." When you describe the benefits of shared decision-making, try openers like, "Planning ahead gives you time to learn about long-term services and supports and allows you to make important choices when you can focus on them without pressure." Or, "Others have said they have peace of mind when they know what they'll do if they can no longer make decisions for themselves or experience declining health." When talking with veterans and family caregivers, ask them if they're ready to talk about sensitive topics such as long-term services and supports or advanced care planning. When doing assessments and finding out what matters most to the veteran, use open-ended questions or statements like, "Tell me how you spend your days." Use active listening skills, focusing on what the veteran says or asks and not on your reply or a fix or a solution. Talk in a straightforward way and avoid jargon. And try integrating other skills you have or for which you have received training, such as motivational interviewing, with shared decision-making. And don't worry, we'll fix all that animation. During shared decision-making discussions, demonstrate empathy when appropriate with statements like, "That sounds difficult." Focus on strategies for maintaining independence. Try openers like, let's talk about living with Parkinson's, or whatever the veteran's conditions are. Then check to ensure what you said was understood and clarify any questions and concerns. Here's another area where you can integrate other training you may have received, such as teach or teach back, where you say, help me know if I've done a good job. Help me know if I've done a good job. Tell me what you understand about home-based primary care. Now let's take a look at potential implementation barriers and strategies to overcome them. There are so many options for long-term services and supports. Many veterans need help understanding what's available before they can decide which options will come closest to meeting their needs and aligning with their goals. Use the website www.va.gov/geriatrics or the overview of long-term services and supports descriptions in the shared decision-making folder. And if the veteran prefers, use the videos on the website or just describe long-term services and supports options. Use the decision aid worksheets to facilitate discussions of how long-term services and supports can help the veteran meet their goals and needs. And even if a veteran doesn't want to fill out the worksheet, you can still go over the questions and issues. Here's another area where you can integrate teach back, and we'll have to put that in one place or the other. There will be situations where cultural practices and preferences or religious issues influence discussion about and choices related to long-term services and supports. Be sure to discuss the veteran's cultural or religious beliefs and their potential influence on long-term services and supports choices. And call on the palliative care team, chaplain, or social worker as appropriate. And remember, family caregivers may or may not be aligned in their beliefs and practices. Strong emotions, such as fear or anger, may arise when facing chronic pain, lack of independence, or life-threatening situations. Many older veterans are also dealing with depression or anxiety or other mental health concerns. All of these can be barriers to shared decision-making discussions and decision-making. It may help to observe, probe for, and acknowledge feelings. Refer to appropriate professionals, such as mental health staff or the chaplain, to address strong emotions or fears. And to connect the veteran with others who have been through similar challenges and used shared decision-making, sometimes this can be done by sharing a story that focuses on the benefits of the process and does not compromise confidentiality. Not having enough time for patient-provider or patient healthcare team discussions is often perceived as a barrier. Many social workers have told us that the initial investment of time into the shared decision-making process, including use of the decision aid worksheets, has helped save time in the long run. In addition, it may help save time by encouraging veterans to be prepared for visits or calls by writing down their questions, looking at the Geriatrics and Extended Care website, www.va.gov/geriatrics, prior to their visit, and or filling out the decision aid worksheet ahead of time. Or try a strategy used by other sites that have successfully implemented shared decision making by mailing shared decision making folders prior to visits, providing information and materials at intake, inviting veterans to make future appointments with social work staff, in person or over the phone, or by offering shared decision making sessions in group visits or shared medical appointments. You may be concerned that informing veterans about services not available in their location could cause frustration and anger. It's okay to acknowledge that not all services are available in all locations, but we want veterans to know about all possible options. If they are aware of what is available in which locations, they may choose to relocate. We are often surprised by the choices veterans make when they have complete information. Of course, you'll want to explore services and supports that are available through VAA and from the community. And be sure to use electronic wait lists to document unmet need for long-term services and supports. By being diligent about doing this, you are doing your part to assist decision makers to plan for and allocate resources. Click on the arrow icon to watch a 22-second video clip about the importance of electronic wait lists. Even with team participation, good information, and good training, shared decision-making discussions with older veterans can be challenging. To support collaborative, patient-directed discussions, start with a discussion of the veteran's goals. What is most important to them? Veterans' values inform their goals, and shared decision-making discussions can help veterans translate their values into goals. Goals are rooted in values, and goals describe living according to what matters most to the veteran. Many healthcare team members and patients find that it is challenging to discuss goals, but by focusing on two main questions, you'll be able to facilitate veterans' participation in a collaborative shared decision-making discussion about what's working well in your current healthcare and the way you manage your conditions, and what bothers you or is burdensome about your healthcare. Ensure that choices and plans align with the veteran's values and are directed at achieving their goals. As always, support and respect the veteran's choices. And you'll want to encourage ongoing discussions because both health status and goals can change over time. This 9-minute video is a model scenario. Most of the actors are veterans. Even the woman who plays the wife of a veteran really is a veteran spouse. The hook that is used to show as many aspects of shared decision-making as possible is a younger social worker schooling an older social worker. We realize this may not be realistic in your workplace, and many social workers have told us that most of the family caregivers they deal with are not as sophisticated as the one shown here. Just remember, it is a model scenario. Now let's practice with some case studies. This is a Marine veteran with multiple comorbidities and a recent diagnosis of Parkinson's. When he was in cardiac rehab, he successfully set and met goals. His wife can drive and assist him with activities of daily living, such as preparing meals and getting dressed. He has not completed an advance directive, and he wants to live in his own home until he dies. How might you engage this veteran and his family caregiver? Think about what you could do or say. Read the 3 options below and check yes or no if the suggested course of action reflects optimal shared decision-making process. When you select the correct response, the box will turn green. Please note that there may be more than one correct response. This Army veteran has multiple comorbidities. She lives alone and has one adult child who lives nearby, though her daughter is still working full-time. It's getting harder for this veteran to find someone to drive her to her clinic appointments. She has an advance directive that she filled out about 15 years ago, and frankly, she just wants the doctor to tell her what to do. How might you engage this veteran and her family caregiver? Think about what you could do or say. Read the 3 options below and check yes or no if the suggested course of action reflects optimal shared decision-making process. When you select the correct response, the box will turn green. Please note that there may be more than one correct response. This Navy veteran has multiple comorbidities and a recent diagnosis of late-onset PTSD. He lives with his wife, who is in relatively good health. His provider recently suggested he fill out an advance directive, and he did so. Mostly, this computer-savvy veteran wants to explore long-term services and supports, and to remain at home as long as possible. How might you engage this veteran and his family caregiver? Think about what you could do or say. Read the 3 options below and check yes or no if the suggested course of action reflects optimal shared decision-making process. When you select the correct response, the box will turn green. Please note that there may be more than one correct response. Finally, let's review next steps for implementation of shared decision-making for aging veterans. Use the decision aid worksheets to help veterans identify goals and priorities, and use information from the decision aid worksheets in collaborative discussions with the veteran, family caregiver, care team, and social worker. Keep in mind that these discussions may be asynchronous and may involve both long-term services and supports and advanced care planning. Be sure to inform veterans and family caregivers about all potentially appropriate long-term services and supports. Ensure veterans understand their medical conditions and how they may affect function and health status over time. Accept veteran-directed choices. Always use electronic wait lists for services that are needed but not available in your location or not available at the time that they are requested. And use shared decision-making often. It's an ongoing process. The next steps for implementation of shared decision-making for aging veterans include: determine what, if any, screening criteria will be used. Use the Geriatrics and Extended Care website, www.va.gov/geriatrics, as well as the shared decision-making hard copy materials such as the folders, wallet cards, and brochures, and then start having shared decision-making discussions. Last, for materials or technical support, please email us at sdmagingveterans@va.gov. We appreciate your feedback about what you liked about this training and what we can do to improve it. Be sure to visit www.va.gov/geriatrics soon and explore the information, resources, tools, and links about all aspects of shared decision-making for aging veterans, from long-term services and supports, including home and community-based services, to well-being, paying for long-term care, and advanced care planning. If you are familiar with the website content, you'll be in a great position to recommend that the veterans and family caregivers you work with take time for a visit. And you can stay current by reading the Geriatrics and Extended Care news features or checking out the other staff resources. If you have not visited the website at all, or it's been a while, click on the arrow icon inside the monitor to take a 6-minute tour that will acquaint you with the topics covered and resources available for veterans, family caregivers, and staff. Thank you for participating in shared decision-making for aging veterans facilitation training 2. We hope that you will encourage implementation of shared decision-making at your medical center, and we look forward to working with you on that. You can contact project staff at sdmagingveterans@va.gov for materials and technical support. We look forward to hearing from you.